Namaskar, I am Manoj Kumar. Welcome to in the program Press Meet. In this program, we cover press conference, media interaction, and a speech of the chief guest at the program. So, without spending so much time, let's go to the video.
Okay, so Diwali advice for pregnant women and children will mostly be to celebrate a safe and clean Diwali. First of all, for the pregnant women, they should avoid taking extra sweets as much as they can. Not to forget their routine medication that has to be taken. They should avoid going directly into the places where there is lots of air pollution, and even if they have to go, they should use a mask. Thirdly, too much of Diwali cleaning should be avoided so that they don't end up in exertion and with long-term backaches. And for children, what is most important is that the excitement should be kept a little low. Don't get too adventurous and try to blow the crackers in your hands. Stay away, protect your eyes while you're doing that, and just be safe. Okay, so arrangements, we have a 24-hour emergency, so we are most of the times prepared for any kind of emergency that lands up. Yes, and some extra resources are being put so that if some kids they come with the burn and everything, so an immediate action can be taken. And for pregnant lady also, there's a doctor on duty all the time. So if they have any kind of trouble, they can immediately report to the hospital, and they will be taken care of once they reach here. Okay, so regarding the stages of the pregnancy and the routine that has to be followed during pregnancy. So the first 3 months are called first trimester. First trimester is a little difficult for the lady. First of all, she is dealing with all the happiness and the excitement of getting pregnant. Then what happens is all the symptoms, they start building up. She starts getting nausea, palpitations, restlessness, the stamina decreases. So what is the most important thing is that she has to take small frequent meals. She should not stay hungry for a very long time and avoid overeating. And all the prescription medication that have been started for her, they should be taken routinely. And they should come for the routine checkups, whether it is ultrasound or blood test, so that if any kind of complication is starting to begin, they can be picked up easily and can be treated. Now coming to the next 3 months, they are the second trimester basically. Second trimester is a little easy for most of the patients because the symptoms of the first trimester, they go away, and the pressure changes of the third trimester have not started as yet. So at this time you should start getting a little active. A diet chart will be given to you, you should follow that. Protein intake is very important. Then all the exercises and counseling sessions that have been advised to you, they should be, you should start attending them. Then obviously all the medications that have been given to you and the ultrasounds which are being regularly advised to you, they should be continued. Then coming on to the third trimester. Third trimester, you have to take care of the baby movements. Then you will start having lots of symptoms like a back pain in your lower back, some kind of discomfort between your legs. So yes, you have to identify the symptoms that are increasing and visit your doctor for the same. And at the same time, some of the things that you can take care of at home also, that specifically regarding your posture, you should sit straight, you should not bend forward to pick up things from the floor. Then the sleeping position should be comfortable, like when you're moving. When you're sleeping on your side, you should take a pillow in between your legs, and when you're sleeping straight, there should be a pillow below your knees. So all these small little things, if you're careful about, then the last 3 months will also go smoothly, and then you will end up with a baby in your arms at the end of 9 months. Yes, regarding the earliest visit to the doctor, first of all, ideally every woman should meet the doctor before she starts planning a conception. Preconceptional counseling is very important because a lot of diseases can be picked up prior to your getting pregnant. But this is not very common in India, so as soon as you miss your period and you get a pregnancy test positive, you should visit your doctor, because there are many tests that are to be done early to prevent further complications, and the earlier you start, the more possibility it is for you to land up in a healthy baby at the end of the pregnancy. And there are some tests which have to be done, which are time specific, they have to be done at certain times. So if you don't come for a long time, even after your pregnancy test becomes positive, those tests can be missed. So once your periods have been missed, like you did not get your periods, 3-4 days have passed, You do a pregnancy test, so within a day or two you should go and visit your doctor. Then the doctor will decide whether you can get a scan done right away or you have to wait another week. So regarding the difference between cesarean and normal delivery. Now see, yes, the mode of delivery is different. Normal per se is a delivery which happens vaginally. Okay. So the recovery is almost the same. There is not much difference between the recovery of a normal delivery and a cesarean. After normal delivery, we send the patient home after 24 hours and after 48 hours in a cesarean section. What has to be taken care of, whether you have delivered normally or via a cesarean, is that you have to take your supplements nicely. Iron, calcium has to be taken routinely as advised by your doctor. Once 6 weeks are over, after your delivery, you have to start exercising. Then the recovery between a cesarean and a normal delivery is not very different. But obviously, if sometimes there are some kinds of practices in families, they don't let the patient move after a cesarean for long hours. They will not let them climb stairs. That is not done. You can start following your normal routine whether you've had a normal delivery or a cesarean. Yes, there are a group of patients who want to go for a cesarean directly, but it's not like that it is with every patient. There are a whole lot of patients who really work hard and want to deliver normally. So it is both ways, whatever is the patient is. See, the back pain after the cesarean being caused by the needle is definitely a myth. The spinal anesthesia that is given, the needle is very thin, very minute, and it will not cause any kind of backache which can last for years altogether. What causes backaches post cesarean is if you gain weight post delivery, you're not exercising and you don't take your supplements properly. That is what will lead to backache. It is not because of the spinal needle. That is totally a myth. So for pregnant women during Diwali, I would just like to advise that don't overexert yourself in the Diwali cleaning because it is totally overrated. You can clean your house anytime. You should avoid all kinds of extra sweets. If you're eating out, you should avoid overeating and preferably eat at home. Avoid going into places where you can see that there is lots of pollution. If you have to go, just use a mask before going. And for children, I would like to say ki don't be very adventurous. Don't try to burst the crackers in your hand. Maintain a safe distance between yourself, your eyes and the crackers, because most of the injuries, they happen in the eyes of the children because they are just bending forward and trying to see whether the cracker is bursting or not. And have a happy and safe Diwali.